Delighted to welcome people in the room and our online audience to this year's Real Challenge lecture. It is the 5th annual Real Challenge lecture. For anyone who would like to post on Blue Sky, today the hashtag is Real Challenge. And the first thing I should say is we are delighted to have Hetan Shah to speak with us today. We're going to have a fabulous lecture, but we'd also like to hear from all of you. So there will be an opportunity after Hetan's talk to ask questions, and I'm going to ask a few questions of you. In order to be able to do that, we're going to use Slido. And so I wonder if, there is, here we go. So would you all take a moment now to join Slido, both to be able to ask the questions and also to get ready for my questions to you. Thank you. So a little bit about the lecture and then a little bit about Hetan. So the Health Foundation set up the Real Centre, of which I had the privilege of being the founding director, which is the Research and Economic Analysis for the Long Term, to provide independent analysis and critical thinking to support better long-term decision-making in the health and care system. The Real Centre produces quantitative projections looking at some of those trends, and if you are interested in that, some of our set-piece work on Health in 2040 looks at the long-term outlook for health in the population. We've also done projections on the workforce and on funding and finance, with the aim really of supporting informed debate and public policy. The lecture, though, sits alongside that work, and it's one of the really important parts of our thinking in creating the Real Centre is that evidence and empirical evidence, I believe and my colleagues believe, is really important to inform policy. But actually, evidence gets you so far, but what you also need is ideas and challenging thinking. And so what we wanted to do to think about the future was to create a space to invite people who had not actually predominantly worked in health or social care, but were involved in public policy, involved in some of the big issues and big ideas of the time, and give them an opportunity to take a step back and bring that expertise and think about what that might mean for health and social care, and to provide, in the best traditions of the 19th century lecture, something of a provocation to make us all have a think about the issues. And this is our 5th lecture, and it has way exceeded our expectations so far. So Andrew Dilnott gave the first lecture on 20 years of NHS spending and debunked some of the myths about what really drives future spending. Hilary Cottam gave a lecture reimagining social care. Andy Haldane looked at the links between the economy and health, never more topical. And last year, Diane Coyle looked at what the NHS might look like in its 100th year anniversary, and in particular, productivity. In Diane's lecture, she talked a lot about the promise, but also the challenges of harnessing the potential of new technology. And that led us to think that actually thinking about new technology and AI was a really important issue for the next lecture. And I think over this last year, the position of the NHS has really reinforced that. As we've seen over the last month, the NHS is still struggling to recover its productivity. The health of our population has not recovered, and we have big issues with life expectancy and healthy life expectancy. But paradoxically, we're also living through an era of remarkable innovation and technological excitement. So how can we understand that potential? Is it hype, hallucination, or should we and can we be hopeful? So when we're thinking about who to ask to give this lecture and think about these issues, and we very quickly decided that we couldn't think of anyone better than Hetan Shah. And I'm very thrilled to say that he didn't take an enormous amount of persuading. So we are very, very lucky and very honoured and very grateful. So just to introduce Hetan to you, if you're not familiar, but I think most of you will be. Hetan is the Chief Executive of the British Academy, which is the UK's National Academy for Humanities and Social Science. Prior to this, he served as Executive Director at the Royal Statistical Society for 8 years. He's chair of Our World in Data, of which I am a massive groupie, which is a website providing long-run data and evidence on global challenges. Hetan was appointed in 2024 by the UK Parliament to the board of the NAO, the UK's independent spending watchdog, so he's also probably very worried about NHS productivity. He played an instrumental role in setting up the Ada Lovelace Institute, which seeks to ensure that AI and data work for people and society, and served as its vice chair for 4 years. He is visiting professor at the Policy Institute of King's College London and a fellow at Birkbeck College at the University of London. He serves on a number of advisory boards, including at the Resolution Foundation, the Bennett Institute for Public Policy at University of Cambridge, and UCL's Policy Lab. And he's a fellow of Birkbeck College, University of London. What he does in his spare time, I don't know, but there you go. We've asked Hetan to speak in a personal capacity, bringing that wealth of experience, but not representing any of those bodies. And the idea here is really to ask somebody who's got that deep, rich breadth of experience to think about our topic and think about health. So I'm delighted, on that note, to welcome Hetan and to invite him to come up and give this year's Real Challenge lecture.
So every lecture on AI basically boils down to this. There are possible benefits, great benefits, but there are risks. Thank you very much. Those of you who are online can switch off now and save yourselves an hour. Those of you who've elected to attend in person, unfortunately, you're trapped here for the next period. And of course, every health talk begins by setting out the pressures on the health system. So waiting lists, blah, blah, trust deficits, blah, blah, demography, blah, blah. Now, luckily, I can skip that part of this lecture as well, because as Anita was saying, Diane Coyle laid this out brilliantly in her Real lecture, and Andy Haldane spoke very eloquently about the consequences on the economy in his. So go back and read those if you want to know more. So let me start somewhere else. As was mentioned, I'm on the board of the National Audit Office, and although I'm not speaking on their behalf or anyone's behalf, I did want to quote from their 2021 report on the challenges in implementing digital change. And it says, despite 25 years of government strategies and countless attempts to deliver digital business change successfully, our reports show a consistent pattern of underperformance. So the big question for me is, why will it be different this time? And this is all in the context of the government having just recently launched its AI Opportunities Plan. And they were so excited, and I'm quoting, they said, we want to mainline AI into the veins of the nation. I mean, call me a boring old fart, but I'm always a tad cautious about having anything put into my veins. So I've only got a brief time to look at really a kind of huge area. So as was said, I'm here to kind of provoke. And in particular, I want to try and focus on the bits that I think are kind of a bit missing from the discussion, as it were. And I'm going to focus on 4 particular kind of headlines. One is, how do we make AI trustworthy? Secondly, how do we layer AI into public services, which are complex systems? Thirdly, can we think more about how we shape the market? And finally, can we think very widely when we are talking about the concept of health? But before I get into those headings, let me just say a few words about the state of play on AI, because some of you will know a lot, but others may know a little bit less. And of course, we've seen lots of use cases of AI in health or health science. One of the most famous, AlphaFold by DeepMind, just won the Nobel Prize. We've seen lots of examples in medical scans, cancer diagnostics, and in more operational situations like medical note-taking. But what is this AI? There are multiple definitions, but very broadly speaking, of course, it's using computer and data systems to perform tasks that were conventionally done by human cognitive functions. But I like to think of it really as a kind of very wide umbrella term. And that's part of the problem when you're starting to say, well, how do we use AI? Because there's lots of things lumped in under this definition, or under this term, ranging all the way from very simple statistical algorithms, which probably aren't AI, but some people do like to claim them as AI, through data science, taking in machine learning, and now, of course, talking and taking in generative AI. And generative AI exploded onto the scene still less than 2 years ago when ChatGPT came into your mobile phone pockets. And it's really come to dominate public understanding of what AI is. Generative AI, of course, creates text, images, and sounds, and so on. But it is worth just remembering that that's not the only form of AI that is out there. And again, it's worth making some of these distinctions. Just to pause for a moment on generative AI, I think the really interesting thing here, despite all of the kind of hype and conversations we hear about it, we're still really trying to work out the use cases of this technology. And talking to people in the private sector, the two areas where there seems to be some progress is in using it on coding and in marketing. But it's still pretty iffy, and there are some companies who've bought in and then actually are uninstalling some of these programs at the moment. It's still a bit glitchy. So this year was somehow talked about as the year of adoption for AI, but actually companies are increasingly talking about it as a year of observation. And I think it's useful for you to know the private sector, which is often lauded as kind of being at the cutting edge of adopting technology, is itself sort of a bit gingerly in places about using Gen AI. As I say, other AIs are available. And in this context, of course, there are a whole batch of concerns about AI. You've heard them many times before. Reliability, I think, is one of the key ones, and especially in Gen AI, the kind of concept of hallucinations. It makes stuff up. You'll have seen maybe this week, the BBC found 51% of AI answers to questions about the news had significant issues, including at the one point when ChatGPT said, well, Rishi Sunak is still in office when he'd left, as it were. And we've seen that kind of hallucinated content even in the medical note-taking aspect of AI as used. It's very hard to get really high-quality evidence on what's the numbers behind this, how many instances are we getting, but it is there. And we are seeing AI companies responding by trying to create new models, what they're calling quote-unquote reasoning models. This isn't reasoning in any kind of human way, but a kind of an attempt to get the model to check itself in the way that it works. There's a big debate in AI circles about whether this will lead to progress or whether actually hallucination is not a bug but a feature, because AI is essentially based on statistical probabilities. So that's one of them, but there are many other concerns, the bias in training data, which you'll have heard a lot about, issues of explainability. Even when the model is pretty good and accurate, you still don't really know why it gave you the answer that it did. And quite an interesting one I came across recently about data poisoning. A very, very small amount of misinformation going into a medical large language model can render it harmful. Having said all that, there are some of these issues. What's really interesting is when you talk to AI companies, they're very, very positive. Now, well, they would be, right? You've got to take what they say with a pinch of salt. But things coming on stream this year, AI agents or agentic AI is the kind of big thing. And I mean, in short, at the moment, we've got a lot of chatbots. They talk to you. agentic AI is AI that will do stuff for you. They'll be able to, the classic example is it will be able to book your holiday, your hotels, your favorite restaurants, and so on. That's allegedly coming on stream this year. Let's see how it works, as it were. But interestingly, if you talk to the kind of big figures in AI, in the next 5 years, virtually all of them are saying we will get human level plus intelligence from AGI, artificial general intelligence. And we're in this odd position where there's big talk about the future of AI, and yet the current models are somewhat glitchy. And how we hold those two things kind of together, it is a bit tricky. And as I was kind of alluding, some of the narrow models that we've seen, rather than these large language models and generative AIs, but models very specifically trained on diagnostic data, et cetera, that's where actually the action is, that those are working. And the final twist in all of this is I like to say that actually AI is just what we call the stuff that doesn't work yet. So as soon as it works, you stop calling it AI and it becomes software. So poor old AI will always be glitchy because it's the bit that doesn't work. And this is paralleled actually in the world of robots, because robots are only called robots till you find a specific use for them and they work. Then you call it a washing machine. So look, I hope that gives you a kind of sense and a flavor of where the discussions are around the kind of whole topic of AI. So let me now move on to my thematic areas. The first is, let's make AI trustworthy. And Baroness Honora O'Neill, who is a former president of the British Academy and a philosopher, has said, and some of you will come across this, it's had big influence in the world of health, we should focus on trustworthiness, not on trust. Trust moves up and down for all sorts of reasons, but actually trustworthiness is the really important characteristic. So what might this mean in the space that we're talking about for AI? And the two areas I want to focus on are evaluation and public engagement. There are plenty of other aspects to this, but in the time I've got, I thought I'd focus on those. So on the kind of space of evaluation, I think in this period of clear hype about the technologies, you really need to keep a cool head and ask, what's the most effective intervention that I want to make for the particular issue that I face? Sounds very obvious. You need to bring the same mindset that you would for drugs or medical devices. But a recent RAND study found that one of the root causes of AI failure in AI projects was that people were wanting to use the latest technology because it was exciting, rather than seeking to solve real user problems. And that's always, I think, a tension that we have to be balancing. You should be asking, what's the opportunity cost of using this technology as against all the other things I could be doing, right? And just to pluck a kind of different kind of example as a kind of an example of something else you could be doing. There's a whole world of frugal innovations, right? Largely in the world of mental health, but in other spaces too. There are randomized control trials of these interventions that you can make, which are highly effective. They may not be the fashion of the month, but they're on your menu if you want them, right? So you should be thinking about all these things at the outset before you make a decision about where you want to focus. And evaluation is also critical because as you know, whenever there's a lucrative market, the snake oil, the grifters appear. How do we evaluate what is really a high quality product? How do we know that somebody's not just relabeling a simple algorithm as AI, which has certainly been happening, or that the products are just not very good, as you'll have seen from multiple apps on medical app stores? And the trouble is, it's just very hard to get independently verified evidence in this space. You have a mixture of hyped press releases from the companies themselves, and on the other hand, newspapers laying into the faults that you've seen in particular models, but very hard to get a kind of actual genuine evidence base. Things are starting to improve. We're seeing a lot of trials, which is really useful. The Edith trial on breast cancer screenings you'll have heard about last week. You may have also seen the Department for Work and Pensions has just shut down about half a dozen AI prototypes that they've been trialing. They were like, these ones didn't work, we're going to carry on with these ones, which is great. I think that's the right approach, right? You test, you learn, you evaluate, you drop what doesn't work. But there is a slight worry. I mean, we've seen in the health system a kind of plethora of pilots, and that could be good on the sort of test and learn model that I'm talking about. But equally, there's a slight worry for me that will the sum be more than will the whole be more than the sum of the parts? Because there's a lot going on. Do we really have the quality of evaluation going on in the system to actually say, or is it just that people want to do something exciting and they've been told they'll get a promotion if they're using AI? So we really need to invest in our evaluative capacities. That means skills, strengthening in particular our statistical capabilities. There's a lot of junk science out there and actually not enough statisticians involved in evaluating all of this. It means the tools. So some of the current tools that we have, like clinical trials, may not be best suited for AI, which can be very dynamic and very context specific in the way that it plays out when it's applied. And I think there's a structural question as well, right? That the multiplicity of NHS trusts we have means that everyone is evaluating everything locally. So surely it's time for a much more centralized approach, a kind of one and done. We've evaluated this thing, you can all use it, as it were. And that should, I hope, lead to stopping the over-evaluation of some quite useful and not very risky tools so that they can just be used, but also proper evaluation of the trickier tools that really need a bit of interrogation. So that was evaluation. Let me now turn to public engagement. And I think that the voice of the public has been really missing in this space. And if we're to make AI trustworthy, it must come in. And I'm not just talking about communicating to the public, I'm saying allowing the public to engage and shape the way that technology is used. There's no shortage of techniques on how to do this. And I wanted to take a moment to pay tribute to Simon Burrell, who some of you will know was an innovator in public involvement and deliberation techniques, who very sadly died last year, only at the age of 54, of a brain tumor. And I want to dedicate this real lecture to him and the pioneering work that he did over the years. And if you're not familiar with his work, I hope you'll take a moment to look him up. We were both involved, for example, in some work with the NHS Test and Trace Public Advisory Group. This was a process bringing together 100 members of the public to feed into thinking about how we dealt with the pandemic, including the data aspects of it. And of course, when you do that, you can improve the policy through co-design. Public members were raising issues that hadn't been thought about centrally, like, what happens if people become uninsurable as a result of some of the things you're planning? What are the sanctions for the misuse of data that you have got planned? But also, public involvement legitimizes your approach. It actually gets buy-in. Other people say, well, okay, some members of the public scrutinize this, therefore I can have a bit more trust in what's going on. And I was really taken by a recent blog by the National Data Guardian, who was looking back on the lessons learned from 3 years in post. And her core message was, let's be straight with the public. This was about data across the piece. Let's not overhype things. Let's be open about the risks. Let's not just revert to corporate communications. And I think what we should all carry in the back of our minds is care.data. You're all health people, you probably know about it, but for those of you who weren't there, a decade ago, here was this very well-intended project to share data, but which in effect lost public license because it slightly took the public for granted. And that mentality can creep in, I think, around AI, a sense of technological arrogance of we know what's good for you. And that takes you so far, but actually the ground can collapse under your feet. And I have to say, I feel like we're seeing the worst version of that right now in the US, with some technological people taking over at the heart of government and saying, we know what's best for you. That I think rightly might worry us. So that was my whole theme around trustworthiness, and trustworthiness will be really critical if we're to embed AI in public services. Let me turn more widely to the question of public services, because they are complex systems, but sometimes policymakers look at AI as if it's magic. And I think that there's a risk of a slightly naive view that technology will just save the day. But as I say, my question is, why will it be different this time when the NHS and public services are littered with failed digital transformation projects? You can't just overlay tech on a failing service. And we've got to be quite careful about not just being driven by a kind of efficiency mentality, which, given the public finances, there's a strong danger that that's what this turns into. But if efficiency is your only goal, you'll be likely to want to design out the complex cases, right? The people who've got the most difficult situations, as it were, and just push them out and design something that is merely efficient. I think we need to look actually back to Hilary Cottam's real lecture, where she, at the heart of that, was asking the question, what's the system that we want? And different people will have different views, but there are clearly common themes of moving from treatment to prevention, from hospital to community-based, from command and control to empowering frontline staff and allowing more public voice, and a strong sense of equitable treatment. Now, if you believe that, then how do we design the AI to move us in that direction? And it leads, I think, that sense of kind of community and relationships leads to questions about what are the things you don't want automated, which I think doesn't get asked enough. And many of you will have tuned into an important documentary about AI on Christmas Day last year. I'm talking, of course, about Wallace and Gromit, which was about gnomes powered by a rogue AI system which goes wrong and completely out of control. And if you did see it, you might remember Wallace, who's very keen on technology, had invented a robotic arm that would pat Gromit for him. And the very last words, when he does away with that, he says, there are some things a machine just can't do, and he pats Gromit, with his own hands, as it were. So I think there is a danger sometimes that AI optimizes what can easily be measured, and those things that can't be measured, which includes relationships and community, can get left out. I don't want to overstate that, and I think actually the Prime Minister was very clear in this when he was saying, we want AI to be used to make back office things more efficient so that actually our workers can spend more time with the people and do the more human things. So if that's how we approach it, great. But technology often kind of reverts to type unless you keep a close eye on it, as it were. And I think there's another danger, which is that the ambition has surely got to be to optimize the whole system. And there are times when actually if you over-optimize one part of the system, it can lead to the whole system actually being slightly more inefficient. You get really, really good at identifying diagnosis in this particular area. The rest of the system can't cope. And in fact, you might actually be doing over-treatment. So these are just things to watch, I think, when thinking about the system as a whole, rather than, oh, this particular tool works really well to do this particular job. And zooming out, AI adoption is just not easy, right? It's not just about the technology, it's about how the technology interacts with people and the environment that it's within. So we've got to invest in key capabilities for innovation. Some of that is about people, it's about skills, culture, leadership. How can we have confidence to take risks and manage those, to learn and adapt? But of course, it also means IT. And again, you will all be more familiar than I am with the world of IT in health, but it's very clear you've got multiple systems at different levels which don't easily talk to one another, making deployment very difficult, and it varies incredibly across trusts. The Institute for Fiscal Studies, for example, has shown the volatility of capital spend over the last decade and how difficult that makes it to kind of get the IT right. It's much easier, I'm taking a private sector example, if you don't have those legacy systems to set yourself up as a digital upstart. So Octopus, the energy company, has done incredibly well because they didn't have the legacy systems that their competitors had. But of course, in government, you can't do that easily. You can't just flip a whole service and get rid of what you used to have. So you have to build functions one at a time and develop them and grow them. I've talked about IT capabilities, but of course, the biggest and most significant capability when you're thinking about AI is data. AI is it's reliant on the data input it has. The quality of the AI is very much constrained by the quality of the data that it is trained on. And the UK has got better data than many other places, including the US. Our accessibility, our quality, these are better than some other places, but there are still issues. And the ability to link in particular is a problem. And also comparison across UK nations is still really not as good as it should be. And some of these issues are there in NHS national data, but they're even worse once you start trying to link with other sorts of data. I mean, primary care data is a real problem in terms of linking to the rest of the system. You'd need to solve the issue of GPs currently being data controllers. When are they ever going to take the risk of sharing their data whilst that's the case? And that's before you get on to non-NHS generated data, citizen generated or research generated data, and environmental data, for example. And I think if you look back during the pandemic, one of the things that was really striking was that the political will was there to make data much more accessible, to enable it to be linked up, and so on. So how can we get some of that energy back? The excellent review by Kathy Sudlow, which many of you will have seen, really maps all of this out brilliantly. And she ends by saying, let's treat health data as a critical national infrastructure and establish a single national health data access system. Now, government is talking about setting up a national data library. No one really knows what they mean, and having talked to government, they don't know either. So maybe this could be part of that. You know, at the end of the day, data, I think, is just the unsexy cousin of AI. And could we just use some of the hype and excitement of AI to smuggle in the investment we need on some of this other critical infrastructure? So I've talked about trustworthiness, and I've talked about public services and the complexity of introducing technology into them. The third theme I wanted to touch on was shaping the market. When the Prime Minister launched the AI Opportunities Plan, he talked about wanting the UK to be a maker, not a taker of the technology. But I would frame it that we want to be the shapers of the technology. And the NHS is in a pretty good position to do this, right? You have the potential to be a single purchaser, but it's really not done enough to signal what it wants AI to be. And I think, you know, we could be pushing much more for saying areas that are otherwise potentially neglected, we want to see AI innovation in these spaces. And that would include prevention, mental health, social care, which again, Andrew Dilnot spoke very eloquently about in his real lecture, and the whole kind of areas that get completely overlooked, like unpaid care. Work by British Academy fellow and Nobel Prize winning economist Darren Acemoglu has shown that technology doesn't automatically have progressive effects. In fact, it indeed often pulls in the opposite direction if it's left to its own devices. So the question is, how do we direct the technology to change things that we want? For example, the power dynamics in the health system, rather than to reinforce them. As an example, it's well known that I talked about AI is powered by data. Marginal groups are often not as well represented in the data. You know, women, disabled people, ethnic minorities, and so on. So how do we turn this on its head to say, can we get the AI to actually overcome these issues rather than to just reinforce the biases that, in the data that it's trained upon? This parallels, I think, an example in the world of corporate recruitment, where if you just give an algorithm the data on who you employ, it will recruit the same people for you. But there are ways of getting the AI to say, well, actually, we want you to look for diversity and excellence in pools that we're bad at. And I think, you know, we need to come at AI with the same kind of mentality. But to shape the market, strategic procurement becomes more important. And if you're not already asleep, I know procurement will send you straight to sleep, so feel free to have a nap. We're going to have to negotiate with the technology giants, right? And these are big, big players. We need to go beyond. I mean, at the moment, there's a lot of technology that is purchased just by the NHS trusts. We certainly need to go a level above that and, as a health system, negotiate. But actually, increasingly, we have to go a level above and say, how can the UK government procure and go toe-to-toe? You know, I mean, if we're talking to just a few companies, actually, we need a negotiation at that level. And that is, I think, going to be a change of approach from the way that we've thought about these things in the past. You'll need to employ people who actually understand the technology and tell you if you're being massively fleeced. But how are you going to hire them and keep them, given that they could earn quite a lot more elsewhere? That's a problem, and I don't have any easy answer for it. it is worth remembering not to undervalue what you as the public sector bring to the table. In particular, the health system holds the data, and the AI only works when it's trained on the data. So you have something that you're bringing to the negotiation which you mustn't undervalue or just give away for free. And finally, I think you've got to think about being careful not to lock into tech monopoly platforms that you can't extricate yourself out of. And it is quite an interesting moment. You'll have seen a couple of weeks ago, we had the DeepSeek moment. This is the Chinese technology, which was trained for a much, much cheaper price, perhaps by ripping off existing technologies, no one's quite sure yet, but is now available open source. And I think this does suggest that there is a potential for much wider marketplace and not just necessarily being locked into the 4 or 5 US tech giants, as it were. Early days yet, but I think you need to pay attention to what your negotiation ability is. And then finally, in this kind of space of shaping the market, one of the things I picked up is that the NHS is not a great body to work with if you're a small organization, small business. And the UK, I think, does have this fantastic startup set of companies. How can the NHS help nurture our own homegrown SME set of talent, as it were? Because it's in our interests, I think, to have these organizations. But the NHS itself will have to change and think about how it works with them to grow that market. And then my final theme is that we need to think about health in a broader way. So far, I've been talking about the health system. I've tried to talk about it fairly widely to include things like mental health and social care, but we need to broaden out again. Now, I know you're all wondering, how have I got so far in a talk about health and not uttered the words the Darzi Review? So let me do that now, but it's not the review that you think. I'm talking about the 2024 IPPR Commission on Health and Prosperity, which was co-chaired by Lord Darzi. He does get everywhere. And that review identified the importance of a number of things like work, industrial strategy, place to our health. And that's the kind of level that I think that we need to broaden out to. And similarly, a recent report that we published at the British Academy, A History of Health Policy, shows that there's a range of other factors that over time have been really critical to our health. That includes the environment, housing, education, transport, poverty, our information environment. So thinking about how AI is going to play out across all of these domains is going to be really critical in terms of thinking about the impact on our collective health and well-being. So let me just take a few really as exemplars. I mean, employment. Will AI give us better quality jobs by getting rid of the drudge? Or is it going to give us poorer quality jobs because of high levels of surveillance, for example? Or classic questions of unemployment as well. Surveillance, it does seem to be taking hold at the kind of lower end of the market. So we're not being replaced by robots, but treated as robots. So the jury is still out on quite how this will play out, but clearly the way that we work has huge effects on our health. Questions about the environment. The whole impact of AI is growing on the environment. I mean, there are positive examples. For example, AI has been used to really improve flight vapor trail reduction. And that has actually had quite a significant impact on environmental issues. Equally, there's growing concern about what this means for energy usage. Now, the IEA World Energy Outlook suggests that AI and data centers were responsible for about 2% of world energy use in 2022. And by 2030, they think that it will only account for 3% of the growth in use of energy. So it may not be quite as high as some of the kind of the worry in the popular press that I've picked up justifies. Having said that, it has huge localized effects. So in Ireland, for example, data centers make up about 17% of electricity demand. So even if at the macro scale that's not the case, at a more micro level, there are definitely issues to be thought through. And there are wider resource impacts which I think are not well understood yet in terms of, for example, water use. I think the biggest issue at the moment is that the companies are just very untransparent, right? So OpenAI just doesn't publish what the energy impacts are on any of this. So it's very hard for us to be able to say, is this really very problematic or not? So that's clearly an area that we should be pushing for. And again, if you happen to be procuring with them, perhaps you could force them down that line. And the information ecosystem, which, you know, we could spend a whole day just talking about that, but what has technology and AI been doing to our information ecosystem? On the one hand, of course, more information is available at our fingertips than ever before, but on the other hand, algorithmic systems in social media seem to have been skewing some people's experiences of information, possibly contributing to polarization and mistrust. I mean, this is all quite contested area, but clearly there has been some stuff going on, and the rising mistrust of vaccines in the US may have had some aspect of this kind of questions about information, the information ecosystem we're in, underlying it, as it were. Similarly, quite complex debates about young people's mental health and the information environment that they're sitting in. I'm not saying that any of these have easy diagnoses or answers, but I do think that we need to be looking at them critically if we're thinking about AI and health. And there may be a whole bunch of other indirect effects as well. So just to pick two examples. One of the big indirect effects, if AI is really successful in economic terms and finally lifts UK productivity, which has been useless for a very, very long time, could the increased tax take that we get from that support a better NHS? I mean, that's quite a roundabout route, but actually quite a significant one, and which is why the government is obsessed with growth. And then quite a different example is, I mean, now that ChatGPT is in your pocket, more and more people will be using it for self-diagnosis, even though that's got its own problems. Are we going to see the rise of the worried well as these tools cascade more into public lives? These complex technologies have very, very wide-ranging effects. Who would have guessed at the time of the rise of the internet that a video-based app called TikTok would be influencing elections 20 years on, as it were? It was just very, very hard to predict. So I just want to round off with 4 or 5 closing remarks. The first is just, to reiterate where I started. We've not been good at digital transformation. So I think a core question has just got to be, how can it be different this time? And clearly there is a need for innovation in public services, but I just think we mustn't assume it's going to be necessarily an easy ride. And so despite the AI hype, we've got to maintain our critical faculties. And it's really useful, I think, to dig under the kind of term of AI to actually say, what do you mean by AI? What's the kind of tool? Is this one of the cutting edge, generative, large language models, which is still a bit glitchy at the moment? Maybe it won't be in a few years. As against narrower models trained on very specific things, which maybe are working really well. And that's, I think ChatGPT in some ways has done a huge disservice to the rest of AI, because actually some of the worries about the generative AI models have been read across to a whole series of other technologies which do seem to work much more effectively. Another reflection is that in the context that, given the political interest that we're seeing all the way from the Prime Minister down, I think it can partly be read. I mean, clearly there's an interest in AI, but politicians are not close enough to really understand the technology. Partly the reason they're keen to be associated with it is they're signaling modernity. You know, I'm a reforming politician, I get it, I want to kind of create change. And so for me, if they're not that bothered about what the technology itself is, can we use the political interest and narrative of AI as cover to smuggle in investment in the boring things we know need to happen around IT and data, for example, at a time when public finances are very tight, and it's always hard to make the case for the dull kind of infrastructural investment. A very different kind of slightly gloomy reflection, but in the current context, I think we just have to bear in mind, is that the US is showing very clearly that politics and technology are intertwined, and it's not a values-free agenda, as it were. And I think this brings me back to my point that we have to meaningfully involve the public to actually help shape where they want the technology to go. And I think sometimes my worry is that this can be framed, that asking questions about technology in the way that I have and others have been, is somehow naive and can be framed as anti-innovation. And actually, I want to turn that round and by pointing to many of the failed projects of the past, like care.data, I would say sometimes proponents of the technology, and not all, I mean, many proponents are very wise, but those who are kind of pushing very hard, they themselves can be the naive ones about what's required to actually get deep-rooted change in social systems through technology. So my final point, coming back really and trying to sum up everything I've been saying, which is let's shape the technology for our own ends, right? For prevention, to rebalance power in the system, to support the most marginalized within it, and to improve our social, environmental, and informational systems. And it's that active shaping rather than leaving technology to its own devices and seeing where it gets us, because that rarely ends well. Thank you very much.
Thank you very much. So we thought after that we'd ask you a few questions. And so will they come up? Will the questions come up onto Slido? So the first question that we want to ask you to answer is, what is the one word that you would use to describe AI today? Let's see what you think. I like fuzzy. Yeah. Yeah. I have two of my children have just finished their masters and are embarking upon move into full-scale adulthood, and I am reminded constantly in my life at the moment about how complex the mix of emotions are when you go through big transitions in life. And I think everything we're describing here is that actually it's not just in our personal life that we can have this, you know, things are both exciting and scary simultaneously. And transitions bring forward a whole range of emotions which are all simultaneously true and valid. Yeah. Which is quite useful. Excellent. So the second question that we wanted to ask you was, on balance, which of these statements would you say best describes how you feel about the NHS using AI? Ooh. No one knows. Oh, there we go. Hey. Okay, well, we're actually, we are all very hopeful. It's that classic thing, isn't it, that the prize is something that actually we're quite optimistic about, but the route to getting there is quite nerve-wracking. Yeah, and so the final question, again, another word cloud, is what do you think the government should prioritise in order for AI to make the quality of healthcare better, which majority of us thought it could? Very good. So I think it's very interesting here that data is staying squarely in the middle. And my understanding from the, and that was obviously a very strong theme in Heaton's lecture, but also the 10-year plan process that the NHS is going through at the moment and the big engagement programme. One of, that's looking at the 3 shifts, digital to analogue, treatment to prevention, hospital to community. And the early feedback from Department of Health and NHS England on what's coming out on the digital to analogue is get the basics right. Staff and patients are saying, we don't have the foundational kit, we don't have the foundational data. And so it would seem quite a strong consensus around that. Thank you very much for that. That's very nice to see. I'm going to move now into questions, and you will have noticed that joined here now by sorry, I need the water now. Yeah. Director of Improvement and Innovation, leading the Health Foundation's work on innovation and technology and AI. And what we're going to do is I'm going to put some of the questions that you've all sent in, thank you very much for that, to Hetan. And then at the end of that, I'm going to invite Malta to offer some reflections, very much from the health world. So one of the first questions, which as social scientists, I really like is, and in particular if you think there are any other sectors that are a bit further ahead in this, is how we resolve this tension between the fail fast, learn fast kind of ethos of innovation, venture capital, the sort of world that's producing some of the things, and in healthcare in particular, the rather cautious, evidence-informed approach based on RCTs and long-term robust evaluation?
It's a great question. I don't think there's a straightforward answer. Partly, I think it depends on what's the level of risk appetite in the system. There is a bit of a trade-off there. I also think it does depend a little bit on what's the kind of intervention. And again, so if you're talking about an operational tool for back office, you can probably do the fail fast model.
Yeah.
If you're talking about a scientific intervention on breast cancer, as it were, then you need that longer term evaluation.
Yeah, thank you. And kind of linked to that, some of this then in that tension is all about the nature of risk and the attitude you have, I guess, to risk. And one of the things that in some of the technology that, as you said, is probably more advanced and more clear-cut, take the use of diagnostics. And this debate that people have been having in the diagnostics and with the public engagement about what is the threshold of quality, if you like, that is legitimate for the AI. If it's as good as the humans, is that good enough? Or does it have to be better than the humans? Does it have to be perfect? Do we inherently view failure by a technology differently to failure by humans?
I think we probably do. And I think this is where, in a way, a kind of rational view of the world would be, as soon as the technology is better than humans, we should definitely be using it and rolling out. Equally, I think, we've just got to take account of how the public feels about the technology being used. And if there's an oversight which was made by an algorithm which I had no opportunity to sort of engage with, that feels different to me. So this is perhaps, again, where when I was talking about optimizing the whole system, if the system starts to feel remote, datafied, I have no control over it, I can't talk to anyone, is there a kind of inherent consequence of that, which is problematic, which is why I think the public involvement and engagement becomes quite important in this.
Can I ask you a follow-up to that? Because I think that is really important. And I was thinking a bit about the parallels and some of the leadership challenge that comes from the parallels with the 2008 great financial crisis, where we had all this amazing technological innovation, essentially data science innovation, going on in financial services and banking. And actually the people leading didn't really understand the systems that their organisations were operating. And we were accumulating cumulative risk that actually people didn't realise. And the black box and the gap between the people who are kind of doing the tech and the people who are leading, well, I'm hugely simplifying 2008, but you get the point. And I guess, I mean, the thing that's quite interesting to me there is, again, when you started to talk in your lecture about complex systems, and you think, well, I mean, you know, that crashed the global economy, and banking is complex, but it's not as complex as people's human health, yeah? And so how do we manage some of that risk? And do you have a sense of, it struck me a lot that there's a lot in here about the type of leadership that we need, the type of approach we need from leaders. It's not just learning how to use ChatGPT and away you go, is it?
And I think this is where being really open, and as I said, I thought the National Data Guardian's kind of sense of being straight with the public is really important, because, look, you know, the system is failing as it stands, right? But to move over to something else which feels a bit strange, has got different kinds of risks, to be able to have that conversation in a fairly open way, I think is really important. And the danger is that we overhype the technology. I mean, you might think of me as being quite negative about the technology. I'm not, but I would call myself not an AI pessimist, but an AI realist, because I want this to work, right? The slight worry, and I think this does happen when politicians get involved, they want to just give the positive spin on this, as it were. But you're in a cycle that we've seen before, where you then get let down later because it never lived up to what was talked about.
Yeah. And so, one other question, which I guess is also that very linked both to our ability to realise the benefits, but also our ability to ensure that this does serve actually our bigger purpose, and I thought the points you made that actually we need to start with the problems. Well, not just the problems, actually the prize. What are we trying to do with health rather than with the technology is really important. And again, one of the big concerns that people have raised, obviously, is the extent to which AI might exacerbate inequalities. And so one of the questions that has come in, and I think is a deep concern for many people, is do you have some thoughts, or do you see any good work that's being done on how we can ensure that AI is anti-racist?
Yeah, it's a great question, and I mean, it gives me the opportunity to use a quote that I didn't have time to put into the whole talk. I had to drop it. But so this is a kind of negative point, but I'll come around to then, therefore, what do we do positively? I kept talking about how important the training data is. And just to give you a kind of sense of how deep-rooted some of the kind of perspectives can go, there is a book club in the US called Fable. And those of you who have a music app like Spotify will know that Spotify Unwrapped at the end of the year tells you what kind of music listener you were. Fable were doing something similar with your book reading. So it would track your book reading and then do a little kind of fun thing to say, you know, you've been reading this or that and the other. One of the passages they sent to somebody in the US was, "Soulful explorer, your journey dives deep into the heart of black narratives and transformative takes, leaving mainstream stories grasping for air. Don't forget to surface for the occasional white author, okay?" Now, I mean, Fable were, you know, I mean, they were mortified when this came out, and they've shut down the large language model, which gave, but I mean, there's some quite deep stuff going on there, right? And I suppose my point is, imagine that large language model doing your treatment recommendations. So how one unpicks this, I mean, at a very deep level, actually, you've really got to build the training data. And, you know, there are big data gaps, and so if we can invest in that will improve things. It's not all just down to AI, but as I say, I do think this question of what you point the AI and what you ask it to do is very important. So that, again, coming back to recruitment, you can point the AI and say, we want to diversify our workforce. We want to find excellence in pools that we've never done it. So at the British Academy, we use a tool called Applied to do our recruitment. It is blind in terms of CVs, in terms of where you've worked in the past. It tries to recruit you on your skills and your competencies. So these are but it requires a different kind of mindset rather than replicating what's already there.
Can I ask you one other thing? You talked in your lecture very powerfully, I thought, about whether AI is going to be job enriching or a real act of surveillance. Another issue which is coming through quite a bit in the professions is this an issue about whether it will profoundly affect the way that people learn and are trained to do their job. So if what AI does is take out a lot of the simpler tasks, and professional services are thinking about this quite a bit at the moment, how do you learn? Yeah, because most people, even if you're a very high skilled professional, yeah, the early stages of your career are often learning and getting that ability to reach judgments and complexity through doing lower level tasks. And accountancy is worrying about this kind of enormously because, you know, you don't need very high end AI law the same to discover that a huge amount of the routine work can now be done by a machine. So how do you learn, but you're still going to need the higher level people. So how do you become the skilled, judgment-informed expert without being able to go through those earlier phases, a lot of which are where you pick up the human touch experience. And if we're going to then be really good at being able to temper the AI and make informed judgments about it, if we've never operated the system, made any of these decisions, worked the system, how could this work? So there's some really interesting stuff going on at the moment in social care about using AI to do a lot of the generation of the paperwork around education and health plans and all those assessments, which consume hours of social work time so that the social worker can get back to interacting with a human being. So I got very excited about this, but then you think, hang on, if that means when you learn to be a social worker that you don't actually know, because you don't actually do the assessment process, if you're an experienced social worker and you've done that for 20 years, now having that automated is liberating, yeah? But how do you become the experienced social worker? How do you make sense of what's coming out of the system if you've never done it? And it seems like how we're going to train and develop people is quite difficult to think through in this future world, so that we're really informed partners with the technology.
Yeah, I think every profession will have to grapple with this, and part of the trouble is, as I was indicating in the lecture, the technology is so dynamic at the moment. We don't quite know where it will stop or whether it will stop, you know. And again, if you talk to the kind of, I mean, I was at the French AI Summit this weekend, and some of the kind of top end, you know, owners of the companies are saying, well, you know, virtually loads of things that humans do at the moment won't be needed in the future. Now, I personally don't quite buy that, but I do think clearly there's a lot of uncertainty as to what the technology will and won't be able to do. I think if one enters a sort of stable era, then human institutions are good at catching up, so we can devise new training platforms, etc. So in the medium run, I'm not that worried. Yeah. But I think during this kind of very disruptive period, you know, I trained as a lawyer. They would lock you in a room with hundreds of boxes where you'd have to kind of go through all the documents to find one document that was kind of problematic, as it were. And it's much, much better that a machine does that. So there are lots of gains to be had, as it were. And not most of that work wasn't meaningful and wouldn't have helped my training. So it could liberate people to be trained better. But again, we need to focus on that actually happening.
Yeah. And so you mentioned that you were at the summit in Paris. And so the question here is about the UK has said it will go its own way on regulation and refused to sign the global AI agreement. Do you have any views on that both in terms of whether it's the right thing to do, but I guess the other thing which I'm quite interested in global technology is whether it's even a practical thing to do.
Yeah, I didn't talk about regulation. I mean, if I had another 20 minutes, I'd have got into regulation. And, you know, the word cloud showed that that was a very important kind of topic. But so let me kind of use this as a hook to just touch on that. I mean, first, just on the AI summit itself, the statement that came out of it, I mean, frankly, is meaningless. And therefore, the UK's decision to sign it or not is really about political signalling rather than any kind of commitment to substance. So I think that's the way to understand that. And I don't envy the UK government its choice. The wider picture on regulation is very, very interesting. The US is very clearly signalling they're going to be very, very deregulatory in this space. They haven't ever been particularly regulatory. China does have regulation, but in particular areas, especially around the kind of free speech sort of agenda. UK has traditionally been quite close to Europe, but actually we have taken quite a different path, and I think a good one in this sense, and I think lots of people fed into it. So Europe, as some of you will know, has created the AI Act. I think philosophically it was founded on quite a problematic reading of technology and was sort of trying to categorize technology in terms of the level of risk that it posed. And when generative AI came along, it actually wrong-footed the whole thing, but they've kind of carried on as was. The UK has taken a much more flexible approach and said, we will think about technology in the context of each sector and how it will play out, because what it means for health will be very different from what it means for finance and so on. And I think that's exactly right. And it's principles-based because the technology is changing so fast. So the framework actually is intellectually, I think, a good one. But in practice, they said, we will ask each regulator to think about what this means for their area. There's been no additional resourcing for the regulators. The regulators may or may not really understand what it means. There are some areas where there are no regulators. In education, who is it that you are getting to think about this? It's not Ofsted that's capable. It's not the DFE that's the regulator, right? So I think there's a gap. And then there are cross-cutting issues. And the classic one, which is very important in health, is liability, right? If an algorithm is the thing that gets you in, there's a problem, who is at fault and where does the liability lie? And at the moment, it's not quite clear who's going to address some of those kind of cross-cutting regulatory issues.
Yeah, yeah. And then one of the other thing is, you did talk, I thought, really importantly about the wider determinants of health. And if you were in charge for the day, as it were, and you were thinking about where to focus on this, do you have, in terms of sort of wider determinants of health and other areas of public policy with AI, do you have an area of opportunity where you think, gosh, I can see that AI could make a really, potentially, if you targeted there, that's potential. It's not too difficult, yeah, in the scheme of things, in your categories of different types of AI, and actually it's a huge opportunity. And do you have what would make you lie awake at night and really worry one?
I mean, the area that most significantly worries me about the UK at the moment is the level of poverty, right? So 1 in 5 people are poor, and this just isn't said enough. Now, having said that, it's not clear to me that AI is the kind of magic wand to be able to solve this, as it were. I mean, AI could help in some of the ways that I've been talking about. In how can it help the people who least have access to services and so on? And I have seen some really good projects of people using actually large language model tools to, write letters on behalf of people who need services or are missing out on benefits, etc. So there are things that could be done, and I think that should be a priority area. But poverty needs a lot more than that, and it's not just a technology issue. So it's not quite a kind of perfect answer to your question, but that is the issue that keeps me awake. And 1 in 3 children are living in poor households, and
yeah. So The other question we've got, and I am somewhat obsessed about productivity, and the real sense we have been, we've looked all the way through at what are the long-term drivers in healthcare. And one of the things that happens kind of all the time is we have great innovations. Yeah, actually, if you look back over the, since the Second World War, transformative innovations in healthcare. Many of them make the new thing is cheaper than the old thing, but cheaper individual treatments has not led to a cheaper NHS, and costs go up and up and up. And so new technology has tended to be a driver of increased spending in healthcare, and this is true across the globe, however you fund that. So I guess one of the reasons why this government is excited about AI in public services is that they think it might be a way out of the challenge of fiscal sustainability, and it'll lead to cheaper public services. Do you think AI could lead to cheaper public services? Are there particular things that we need to focus on for it, or is that actually snake oil?
I mean, there are clearly areas where AI could make the system more efficient, but I think I specifically said, I think if you just try and focus on efficiency, it's not going to work for a whole host of reasons. I mean, partly what you're saying. Actually, the real benefits of AI or kind of transformative technologies comes when you have to redesign the system. And if you just try and carry on as it is, but kind of make it a bit faster, you won't get the kind of full benefits. So, and again, as we learn more about how the technology develops, because I think the dynamism of the technology, if you were to ask me to give this lecture in 2 years' time, the technology will look quite different, and and so on. But I do think you're right that ultimately the demand clearly for healthcare is just growing across the piece, and even if the technology slightly dampens things down, demand I think will continue to grow. And what I was talking about, the public having ChatGPT in their pocket, that might actually drive up demand if you've got the kind of worried well phenomenon as well.
Yeah, and on that, you talked a lot at the beginning of your lecture and actually all the way through about co-production and a different relationship of the citizen, essentially, in public services, and that must be right. One of the things that is quite interesting in health, and in particularly, I guess, in social care, is the extent to which we have still very strong gatekeeping functions, very strong needs-based functions which determine who gets in. And an enormous amount of people's time is spent navigating how to get in. So some of that is, deeply frustrating for people, but others of that obviously is about how we try to ensure that public funds are used for those with greatest need and cost effectively. One of the things that strike me with a lot of technology is that actually it's going to be very difficult to operate those gatekeeping. And we're seeing it kind of already, interestingly, with the evolution of screening, where we have this wonderful structure of a national committee on screening that determines what screening should be available, how it should operate. Back to that evaluation question, based on really thoughtful, careful evidence about balance of harm, of over-screening, and cost effectiveness. And now you've got all this venture capital and tech moving into more and more direct access screening, low cost, easy access. If people get screened, what is the NHS, what is the GP going to do if then what someone does is pitch up there with their results? And so how far does actually this world and what you're talking about change and actually make that sort of fundamental approach that the state will carefully decide, and then it will have these professionals that will thoughtfully, hopefully, police who gets in for what and how? I mean, is this the beginning of the end of that?
Yeah. This is where, I was saying that it's very hard with the general purpose technology to actually make predictions, right? So if you look back at what we thought the internet would do, we were pretty wrong, and it's played out in quite different ways. And I think the provocation of what you're suggesting is a good one, but it may or may not end up like that. But I think you're right to say that these kind of quote-unquote democratizing forces, and I say democracy in a slightly loose way, but giving individuals more power, clearly at one level is very positive, giving people the kind of ability to do this, take some control, but from a system-wide perspective can lead to all sorts of kind of strange consequences. And I suppose when I was saying one has to think about optimizing the system rather than each individual bit of the system, that's slightly what I'm getting at.
Yeah. And so the final question that I'll ask actually has two parts in that people have raised. And I think it's a really interesting issue. I mean, you've rightly, I think, emphasised how much flux we're in. And this is for all public services, but I think particularly for the NHS, really difficult, really countercultural. We like to do things very purposefully and very carefully in very managed ways. But if we're going to make this work, as you said, we need public and patients to be really active, engaged partners, both in design and then utilisation. And we need the workforce to be really engaged, especially probably with the right leadership. How do we get the sort of literacy, digital literacy, AI literacy, understanding of what is really quite nuanced and complex into a workforce of over 1 million? If you added the social care workforce, it's like 1.6 million. It's turning over all the time, hugely different skills, workforce coming in from all different countries and systems. And then, you know, all of us use healthcare. And so how do we approach that kind of upskilling, if you like, of across so many people on something so complex and so dynamic?
I mean, my short answer is I have no bloody idea.
No, that's fine. I didn't expect you. Yeah.
But I think it is worth distinguishing between technologies which just work relatively seamlessly, where you don't need, you know, my parents don't need to understand digital technology to be able to answer the telephone, is it? No. And so, sometimes I think people who have an issue then immediately attach X literacy as a kind of campaign objective, and you don't always need X literacy. Yeah. But you then, of course, with these more, the kind of flux technologies, you need some literacy in the system. But I think the question is, who, for what purpose? Is it the gatekeeping of we're going to pick this up and start using it and so on? And I do think a productive bringing in of technologists into the system, because my worry always is that different communities don't understand each other enough. So I was being a bit critical about technologists, but only in the sense that, you know, that those that don't really understand public services, but equally, public servants don't necessarily understand technology. So if we can create a live community of learning where different people can share their experience, new things come out of that. It's not easy to do, and actually, it's often a leadership question, I think.
Yeah, brilliant. Thank you very much. You provoked a lot of really good discussions, and thank you for, there were some tough questions. Thank you for working with that. So, Malta, you get now an opportunity to reflect on that, and in particular, I guess then, you know, I mean, this is hugely broad-ranging, but for the NHS, where do we start with that? Where do we go? How do we approach this? Your reflections?
Thank you, Anita, and thank you, Hetan, for the wonderful lecture. If I maybe start what we heard in the room with the word cloud, because the things I picked out on the question of the one word was, it's exciting and it's scary, and it's hype, but also potential and opportunity, which is, I think, is reflected in the discussion. When we asked the question about what should the government do, there was data and infrastructure, there was evaluation, regulation, education and training, and also equity, which again is very reflective. And when we asked the question about, is AI going to improve services, and healthcare, 64%, 63%, I think, of you in the room and online said, yes, it will. But that, of course, leaves this 36% who are not sure or say no. And we know from our own polling at the Health Foundation that there's very particular groups where that range actually starts to flip and how we engage with those groups to have the right conversation. If I come to Hetan's words, which is impossible to summarize in a minute, so apologies in advance, but you talked about hype and hallucination and hope. And I think under hype, you asked the question, are we in a year of adoption, or are we really still in a year or years of observation of AI as a solution that is possibly still looking for its problem and use case? Under hallucination, you asked the question, to what extent are the issues in AI, whether it's around bias and data, explainability or otherwise, are they a feature or are they a bug? And we don't really know yet because it's too early to say. And you also asked the question, to what extent are we balancing this towards the excitement about new opportunities in kit and technology rather than the evidence and keeping our critical faculties? And when it came to hope, you talked about making AI trustworthy and the role of evidence and evaluation within that, but also the role of engagement with the public, with staff, with users to really understand the technology transparently. And you ended under hope, I think, with the idea of shaping what we want from AI and the society and public services that we want from AI in terms of the human connection, for example, which we again know from our own polling, the foundation, that that's the biggest concern people have around technology and AI and healthcare. To improve equity, not just to be inclusive, but to actually improve equity and access in healthcare, and then to actually be impactful and positive for society more widely, not just for a particular process or public service. I mean, if I come to a few reflections around all of this, and specifically for the NHS, on this point around use case and evaluation, I think the question that's often asked is, how much more do we need to trial or put data into an AI model until it's good enough to do, to sort of be there? And I think that's the wrong way around. I think the question we should ask the public and users is, what's the bar that we would like to reach, at which point we're happy for AI to play a particular role for us, and to ask very transparent questions around those trade-offs. If it's a lot faster than where we are today, but has slightly lower accuracy, are we willing to accept that for particular use cases? And then to ask the question, can AI do it for us? Because maybe it can't. Well, there's more frugal solutions that can make that happen. You made the point also about engaging with the public and openness about risk. I feel quite strongly that in the public discourse that we're having, and I don't just mean politicians, but sort of more widely, there is a lot more opportunity to talk transparently about that. If we're trying to introduce something new, it will go wrong. And when it does go wrong, then we have ways of having that conversation and mitigating it, and still have an improvement over time around it. And it feels sometimes we're trying to keep that silent, but we all know it's going to happen. And actually that transparency and openness in the discourse and bringing people with us and staff is so important around that. Also on coming to shaping, point around shaping, we're sitting here today, for those of you in the room, the Royal College of Physicians. And I think there is also an element of shaping by the profession in healthcare to say, what is the type of role we would like to have for ourselves? What do we want our profession to look like in 5 years' time and in 10 years' time? And then what's the technology that's available that can make that happen for us? And again, I feel that still in too many cases, the conversation is about what's out there today and what's the risk for us, or how does it undermine what we do today, or can we really implement it as it is? I think we can turn it around and say, what is it that we want to shape? And then how are we going to have that conversation to make it happen? Two more points to close, because I think they're very relevant to this debate and more widely what we're seeing in healthcare and the NHS, particularly at the moment around the 10-year plan. You sort of said in your closing remarks, maybe we can smuggle into the excitement, that the importance on infrastructure, on data, of technology, and on change. And I think this emphasis on that this is about the change and not the technology, on designing the model of care or the system, not just the kit, is so incredibly important. And if we generate excitement about AI and technology, actually, can we generate excitement about implementation and change, of which the technology and AI is one element, which sometimes gets lost because it doesn't sound quite as exciting as part of it. And finally, the point about using AI and technology to shape the society and the system that we want. I think within the Health Foundation, we're trying to capture that by talking about the implementation of responsible AI for healthcare and having a strategy for the responsible deployment of AI. Because if we don't coordinate it, then there will be losers and there will be winners, and we want everyone to benefit from it. We had a previous event where someone termed the coin AI aristocracy, the people who can already benefit for whatever reason it might be, but actually we don't want an AI aristocracy, and for that we need to coordinate that in really good ways. And responsible AI doesn't just mean the processes and the efficiency, it means all the effects and impacts that it has on us and our lives and our well-being, not just the particular care that we receive for process. So thank you so much, Hetan.
Thank you very much. Well, thank you, Hetan, for a fantastic lecture, and 5 years seems quite a milestone. And it's great to have something which is so forward-looking in that, and so thoughtful. And I'm a member of the Academy of Social Sciences and the Campaign for Social Sciences, and I think you beautifully showed how bringing that wide social science perspective also to the issue of technology is really, really important. Thank you, Malta. Thank you very much for being such an engaged audience, for answering the polling questions and some fantastic questions. The event has been recorded and will be available to watch on demand, so you can share with any colleagues and you can share on social media for anyone who may have missed it. For those of you who have joined us online, you should see a feedback survey pop up on the event platform in just a second. And we were ever so grateful if you wouldn't mind filling that in. In the room, you don't get away without giving feedback. We know where you are electronically and we'll be sending it to you. Please, please, please do fill it in. If you want to have a shorter recap as well, there's I've written a fantastic blog, which is going up on our website simultaneously on AI. And if this has whetted your appetite to explore the issues of AI in further detail, it might seem a long way away, but it'll come round really quickly. Pop in your calendar at the moment, Tuesday the 14th of October, because you need to be at King's Place or online. King's Place, where the Health Foundation will have a follow-up event specifically on AI. And I'm going to go away and have a cup of coffee, and then in a week or two think about what topic we have for our next lecture. And so I hope that we will also see you next year for the 6th Real Centre Challenge lecture. Thank you very much for joining us today, for engaging so positively. Thank you once again to Hetan for an amazing lecture, and I wonder if we could end by thanking Hetan in the traditional way.